Hi, let's go over the curriculum of this crush rotation. I'm going to mention maybe most of the topics, and we may add other topics as we go through the course. One important thing, I'm going to be release the videos as soon as I finish them and not to wait for the whole course to finish and then upload all of them. So, and the topics I'm going to mention here, not in order, but we will be talking about the ICU. We'll start from the scratch, the ICU room, to get you a feeling of how ICU looks like, the ICU nurses and nurses to patient ratio, who gets admitted to ICU, when to transfer out, and where to discharge from, where to transfer or sometimes discharge patients directly from ICU. We'll talk about critically ill patients, how those patients looks like regarding their hemodynamics and the fact that most of the time multiple organs are affected. We'll talk about managing critically ill patients in the ED before they get transferred to ICU. We'll talk about the ICU monitors, how to read the monitors and all the numbers there. And that means we'll talk about all the possible lines that critically ill patients will have, like a central line, a cordis, a dialysis catheter, the CVP monitoring through that, the arterial line, whether radial, brachial, or femoral, drips, all different kinds of drips, and continuous IV infusions. Then we'll talk about the ICU. We'll talk as well about the ICU admission orders, ICU progress notes, transfer notes, sign-out process surrounding an ICU patients. We'll talk about the closed versus open ICU. Again, these are not in order, but in the crash course it will be in a proper order. We'll talk about the inputs and outputs monitoring and daily weight. We'll talk about nutrition in critically ill patients. We'll talk about the different kind of tube, NG tube, PIC tube, J tube, OG tube. Talk about monitoring the tube feed, risk of aspiration, the medication that you can give through the NG and medication you can't, just to give an idea. We'll talk about also family discussions, goals of care, code of status, who can make decision for the patients. We'll talk about the general care of ICU patients. And we'll talk about after that, we'll talk about the shock and its management, hypoxia, mechanical ventilation, sedation, pain management in ICU, the stroke, the TPA protocol, intracranial, the stroke with ischemic and hemorrhagic, the neurocheck CRRT and dialysis, encephalopathy and agitation, seizures, including status epilepticus, urine output, Foley catheter troubleshooting, volume overload, arrhythmias. Talk about surgical patients that we participate in their care, diabetes or blood sugar management, constipation, diarrhea, fever, high temperature or low temperature, code hearts, code strokes, cardiac arrest, and hypothermia protocol. We'll also talk about skin rashes in ICU, pressure sores and wound care, critical values, death pronouncement, GI bleed, code blue, and many other topics, including how to bill for ICU notes. Again, we definitely will be adding here and adjusting there, but this is a general idea, the topic we will be discussing in ICU. Again, the order here is not in a proper order, but we will release the videos in a proper order. Again, we'll be releasing videos as soon as they finish. We will not wait for the whole course to finish and then release it. So if you are in, I'll see you next video.